Welcome to Humanautic, unlocking the secrets inside your body and brain. Incision and drainage is one of the most common minor surgical procedures. In this video, we'll cover indications, anatomy, instruments, step-by-step technique, aftercare, and common mistakes, exactly what you need for exams and ward practice. What is an abscess? An abscess is a localized collection of pus caused by infection, commonly due to Staphylococcus aureus. It presents with pain, swelling, redness, warmth, and fluctuation. Indications and AMP. Contraindications. I and AMP. D is indicated when an abscess is fluctuant, painful, or enlarging, and when conservative treatment has failed. 1. Fluctuant abscess. 2. Localized infection. 3. Systemic symptoms with local collection. Contraindications. Do not perform I and AMP. D in deep abscesses, pulsatile swellings, or areas close to major vessels or nerves without imaging or senior supervision. Instruments required. You'll need basic minor OT instruments. 1. Sterile gloves and AMP, drapes. 2. Antiseptic solution. 3. 10 to 20 milliliters syringe plus needle. 4. Scalpel blade number 11 or 15. 5. Artery forceps. 6. Swab sticks. 7. Gauze and AMP, dressing. 8. Saline for irrigation. 9. Local anesthetic, lignocaine 1 to 2%. Anesthesia and AMP, preparation. Clean the area thoroughly and drape it. Infiltrate local anesthesia around the abscess, not into the pus cavity, as pus inactivates lignocaine. Never inject anesthetic into the abscess cavity. Step-by-step procedure. Step 1. Incision. Make a small but adequate incision over the most fluctuant point. Always incise along skin creases for better healing. Step 2. Drainage. Allow pus to drain spontaneously. Gently apply pressure around the abscess. Step 3. Break loculations. Insert a closed artery forceps, then open it gently to break internal septations. Step 4. Irrigation. Irrigate the cavity thoroughly with normal saline until the fluid runs clear. Step 5. Packing, if needed. Loosely pack the cavity with gauze if the abscess is large, to prevent premature closure. Post-procedure care. Apply a sterile dressing. Advise daily dressing changes and keep the area clean. Antibiotics. Not always required. Indicated if cellulitis present, diabetes, immunocompromised, systemic infection, pain control, NSAIDs or paracetamol. Complications and AMP. Common mistakes. Common mistakes include inadequate incision, failure to break loculations, and premature wound closure. Possible complications. 1. Recurrence. 2. Scarring. 3. Spread of infection. 4. Bleeding. Exam pearls and AMP. Final tips. Remember these exam points. Antibiotics alone do not cure abscess. Incision should be dependent. Always send pus for culture if recurrent or severe. Never forget tetanus status. Mastering I and AMP. D is essential for every surgical student. Practice under supervision, and always prioritize patient safety. This is Humanautic, unlocking the secrets inside the body and brain. Like, share, and subscribe for more surgical skills, anatomy, and clinical science made simple.